Hello, everyone, and thank you for tuning in for another episode of Wednesday Wellness with Leora. Today, we are exploring a surprising common denominator of Lyme disease and breast implant illness. With us tonight are Dr. Randall Feingold. He is the co-founder of New York Breast Reconstruction and Plastic Surgery. And we have also Dr. Lee Cowden, who is a Lyme disease specialist. During this episode, we are going to hear about a successful herbal Lyme disease protocol, which has about 70 to 80% success rate, especially when antibiotics are not actually helping, and how some women that are suffering from breast implant illness can actually heal using this same herbal remedies. We'll first ask you, Dr. Randall Feingold, if you could repeat again the symptoms, the common symptoms of breast implant illness, and also what bacteria and pathogens do you usually find in these capsules during en-bloc explant surgery?
So breast implant illness is a constellation of symptoms, and patients may have a few symptoms or many symptoms. It may be common to many patients. Some patients have some more unique symptoms, but it's a diagnosis of exclusion when patients have undergone medical workup and they cannot really find a cause for their symptoms in the rheumatologic or immunologic or infectious disease or endocrine type of diagnoses, and it may overlap with symptoms of some of those illnesses. Some of those symptoms are fatigue and brain fog, visual changes, hair loss, skin rashes, joint pain for sure. I've seen patients with bronchospastic conditions and asthma symptoms and migraines and vertigo and a host of neurologic findings as well. So it can be perplexing trying to figure out what the cause is. And we don't want to jump to the diagnosis instantly that it's related to having a breast implant. But we know that an implant is a foreign object in the body. There can be acute and chronic inflammation in the scar capsule that the body makes around implants. And sometimes we find subtle pathology related to silicone granulomas, but sometimes we find colonies of bacteria, colonies of fungus, and on rare occasion, malignancies within the capsule. So we know that the capsule is like a living dynamic, and patients can have symptoms related to implants and their capsules. And if we are confident that they don't have a disease that's, external to their breast implants, you don't want to overlook the possibility that removing the implant in the capsule is going to give them relief. And there are many patients we've all heard of, and many patients I've treated in my practice that have quite noticeable, even remarkable improvements or recovery from symptoms. So you have to be a flexible thinker when it comes to medical diagnosis, and you want to be a detective to get the diagnosis right. And at the end of the day, nobody knows your body like yourself in terms of symptoms. And when you know something's not feeling right and it seems to be temporally related to having implants in the body, it's something certainly to consider.
Amazing. So can you tell us, when you're sending these capsules to pathology, what is the percentage of women that actually came positive? And you also mentioned in a previous podcast the word biofilm, and it has been coming out quite often when we look into also Lyme disease. And anytime we have a foreign device, whether it's breast implant.
Well, I think biofilm is recognized in plastic surgery as something that's very common on breast implants, and much has been written and taught about in the field of breast augmentation about the proper preparation of the skin, the breast, the incision, the handling of the implant, changing gloves, using certain antiseptic techniques, to minimize biofilm or bacterial contamination. But there seems to be sort of general acceptance that there's going to be some biofilm to some degree, and that it takes a lot of effort to minimize it. You probably can't really eliminate it. but I think it's overlooked because we have patients that, probably 25% of my patients have positive tissue cultures from the lining of their capsules growing bacteria, and on rare occasions fungus. And so when you see, colonies of bacteria or fungus that have been living in capsules for decades, I find it hard not to believe, that it could be causing symptoms in patients because they secrete their own inflammatory enzymes or byproducts, and it's got no business being there, buried in your breast or in your chest wall for, especially for all those years. So I think these are, very relevant findings.
Dr. Lee Cowden,
Agreed.
what's your take on this, on whatever you're hearing right now about the breast implant illness?
Oh yeah, I agree completely with Dr. Feingold that a large percentage of patients that have implants, whether it's breast implants or other implants, have microbes adjacent to those implants, and it's not uncommon for the microbes to produce biofilm. We know that Borrelia that causes Lyme disease is a prolific biofilm former. We know that Candida, some of the Staphylococcus species are prolific biofilm formers. Dr. Fry at the Fry Laboratory in Scottsdale, Arizona, has also found that a lot of patients have protomyxozoa, and as far as I know, he has the only lab that will actually test for the protomyxozoa. But it's an organism that's somewhere between a protozoa and a fungus, and it's a prolific biofilm former. The biofilm is like a snot-like substance that the microbes can hide inside of and not be affected by the white blood cells that are trying to find and get rid of those microbes. And also the biofilm makes it very hard for standard antibiotics to penetrate to kill off the microbes inside the biofilm. So it's a nice nest to stay inside of, to live unscathed for a long period of time.
So, I mean, is there any way to treat this biofilm?
Mm-hmm. Yep. Yeah, you have to have the right substances that will penetrate biofilm. For example, with the Borrelia biofilm, Dr. Eva Sapi at the University of New Haven, Connecticut, did some very sophisticated research with biofilm produced by Borrelia. And she found that the most common antibiotic used by doctors for treatment of Lyme disease, which is doxycycline, does not penetrate the biofilm well enough to kill off all the microbes inside the biofilm. But she found that a couple of herbal products do penetrate the biofilm, do kill off the microbes inside the biofilm, and therefore causes the biofilm to break down because there's no longer any microbes producing the biofilm. And so that was published in the Townsend newsletter in 2010, I think it was. And that's not a peer-reviewed journal, but Dr. Sapi has published her information, that she's been doing in her lab for many decades in a variety of other peer-reviewed journals. So we know that her work is sound, is reliable.
Dr. Feingold, have you found that among your patients with breast implant illness, that they're more susceptible to getting more what we call co-infection, whether it's Lyme disease or other infections?
I'm not quite certain that I have the data, to answer that question accurately. I just know that they're very distracted by their symptoms, and they're not always infectious related symptoms. Sometimes it's neurologic, sometimes it's cutaneous, skin, sometimes it's more bone and joint. Sometimes they have a history of Epstein-Barr virus or Lyme disease, which just makes it a little bit more complex trying to figure out what the cause of their symptoms are. But since all the patients I treat have implants in place, we are targeting the implant and the capsule as a factor. Maybe it's a cofactor, maybe it's the only factor, but that's, the tools that I have to work with, relate to the surgical therapy. not the medical therapies that Dr. Cowden might be able to talk about.
Dr. Cowden, can you share with us actually your thoughts about silicone found in the blood or in the lymph node of women that have breast implant illness? Can you elaborate on that?
Well, I think that when a white blood cell bumps up against a piece of silicone, that it makes an effort to try to phagocytose it, to chew it up. And sometimes it can accomplish, but chewing off a little piece of that. When those white blood cells then migrate in the venous system or the lymphatic system elsewhere, at some point that white blood cell is going to die. And when they do die, they deposit the silicone that's indigestible inside their cells back into those new tissues. So that's one of the ways that I believe that silicone is spread to the brain, to the joints, to the other places in the body. And so the white blood cells become a metastasizing agent for the silicone moving throughout the body. Borrelia produces biotoxins, at least one, maybe more than one biotoxin, that poison the immune system. And Candida, which is also found in the area of the breast where there's silicone implants, produces biotoxins as well. And those biotoxins are very toxic. They're more toxic than any other toxin on the planet, other than radioactive elements and possibly mercury. So, those biotoxins, the mycotoxins from fungi and the biotoxins from Borrelia and certain other bacteria, powerfully impair the function of the immune system and therefore predisposed to other diseases, including cancer, as Dr. Feingold mentioned a moment ago, found in some of the lumps of silicone that have gotten out of the breast.
Dr. Cowden, do you think then that somebody who's had a history of Lyme disease in the past is going to be more susceptible to these systemic symptoms if they have breast implants?
I do believe strongly that that's the case. And we know that Lyme disease is a lot more common than most patients recognize. There was an article published in British Medical Journal last year where they used laboratory testing to determine what the percentage of infected people were in every country of the world. And they determined that 14% of the world population are infected with Borrelia. Now, we know that from other research that's been done that half of the laboratory testing that's done for Borrelia misses the diagnosis. So that means that the percentage of people that are affected worldwide is actually probably closer to 28%. And a lot of those people don't have a clue that they have Lyme disease in their body affecting them.
Do you think that treating Lyme disease or the agents that would be used to treat Lyme disease might have a role in maybe partially improving symptoms in women that have breast implants and think they have breast implant illness?
Yes, and I have a list of about 15 or 20 different articles from the peer-reviewed literature, though, that say that if a person has had Lyme disease for more than 6 months, the probability of eradicating the borreliosis with standard pharmaceutical antibiotics is extremely low, extremely ineffective. And so that's why I worked on trying to find another way to get rid of the Lyme disease without using the standard pharmaceutical antibiotics.
Well, I don't think taking the breast implant in a capsule out will eliminate all the symptoms if they've got borreliosis in their background, but perhaps treating Borrelia might at least partially improve their symptoms if they have breast implant symptoms. But ultimately they're going to have that implant removed, I guess.
I think that's true. I think that when you have pieces of silicone getting out of the implant by various routes and getting into the lymphatic system and clogging up the lymphatic system, you get a impairment of drainage of toxins away from all the other tissues of the body. When the toxins build up in the tissues of the body, it creates an environment that makes it easy for microbes to grow there, including borreliosis. and it makes it hard for white blood cells to go in there and do their job because the environment is too toxic from the pesticides, the herbicides, the heavy metals, and the other toxins that are there. And so I think that it's something where you would consider doing treatment with a natural protocol for Lyme disease, which has extremely low adverse event rate and a pretty high success rate, at least an 80% success rate based on our experience. And so if you start a treatment protocol with an all-natural program in someone that has breast implants, you can lower the load of the Borrelia and the co-infections in that person, improve their immune function, and hopefully reduce their symptoms some. But again, it may not eliminate their symptoms because a bigger part of the problem might be the silicone that's blocking their lymphatic drainage away from the tissues.
Is there a specific test I should be ordering on patients that come in with systemic symptoms and breast implants to determine their prior exposure to Borrelia, or whether they have a residual or active or persistent Borrelia in their system?
Yeah, I think one of the best blood panels to look for borreliosis is a panel that's done by IGENX, IGENX. And IGENX is in California, and they do a variety of different types of testing. Some of them are pretty pricey, and sometimes insurance companies balk at paying for those. So you have to inform the patients that they may be stuck with a bill if they're going to do the testing. But anyway, that's one approach. And there's a couple of other laboratories in the United States, MDL and Vibrant Wellness do the testing also. And if you do now, there's a lot of laboratories that I think is a waste of time and money. I think most of the Lyme testing that I've done through LabCorp and Quest have not yielded positive results when we had very clear evidence that the patient was infected with Lyme disease. So, it's probably best to not just do a single test through LabCorp or Quest and say, oh, you're negative, so you don't have Lyme disease. I think that's a major mistake.
Are you referring to the commonplace Lyme titer, where you're looking for antibody against
Yeah.
Lyme
Well,
disease?
the CDC says we should do a ELISA, ELISA, enzyme-linked immunosorbent assay, and if that was negative, then stop there. But we know that probably at least half the patients that have a negative ELISA still have Lyme disease by one of the other testing processes, blood testing processes. So even with what's called a Western blot test for Borrelia, you can still miss the diagnosis. There's about 30 species of Borrelia that can affect the human body, and the ones that are tested for by the ELISA and the Western blot is the Borrelia burgdorferi. That's the worst type of Borrelia that you can find because that was the one that was genetically engineered. But there's about 30 other species of Borrelia that can cause a lot of symptoms, and that's documented in the literature as well. But beyond that, we have a variety of different co-infections. Co-infections are other microbes that come into the body at the same time that you get the exposure to the Borrelia. That includes Bartonella, Babesia, Ehrlichia, Coxiella, Anaplasma, a variety of mycoplasmas, and probably others. And so, most of the laboratories that test for Bartonella only test for one species, and there's 32 species that can cause illness in humans. Most laboratories only test for one species of Babesia, even though there's at least 10 or 12 others that can cause disease in humans, and so on. So, because the testing process is so inadequate, so primitive, we miss the diagnosis in a large percentage of the patients. And a patient can have Borrelia, Bartonella, Babesia, and several of those other co-infections without having any Borrelia at all.
Can I ask you what you meant when you said a bit ago about Borrelia burgdorferi being genetically engineered?
Yeah, that's interesting.
Yeah, The work that was started on that was actually started during the Second World War by the scientists that worked for Hitler. And when the war was over, the United States and the Russians said, we can't leave all these scientists in Germany because they'll rebuild the war machine and we'll just have another Third World War. So what they did is they divvied out the scientists to Russia and to the United States on every other one goes to one place or the other. And the ones that were working on the Borrelia biowarfare were sent to Lyme, to Plum Island off the coast of Lyme, Connecticut. And sometime in the process of doing their research over the next few years, then the microbes migrated via birds from that lab to the mainland. And then in the summer of 1975, a whole bunch of children all developed juvenile rheumatoid arthritis in one summer. And they said, well, this has got to be a vector-borne illness. So Dr. Willy Bergdorfer spent about a year trying to figure out what it was. And he found a Borrelia in the gut of the deer tick that was apparently the vector for transmitting Borrelia to the children. Anyway, you can read all about that in the book Lab 257.
Well, this is very interesting to me because while there are successes in explant surgery in terms of improving symptoms, it's certainly not 100%. And so there may be more than one etiology of the symptoms, and there may be cofactors between infectious organisms and breast implants. But now I'm wondering if screening for Borrelia should be part of my preoperative workup in my patients, because if we know they're positive, there may be more to offer the patient in terms of treatment than just removing their implant. I know you said that if you're infected with Borrelia for more than 6 months and you're not treated, it's unlikely that you're going to be able to cure it. But I'm just wondering if it could help turn the course of some of my breast implant patients if we knew that Borrelia was a factor.
Well, I think what I would do practically is to start patients on a all natural herbal protocol, which has close to zero adverse event rate for about 4 months, because we found that about 4 months is when the tide turns. Sometimes it's in the first month, but in many cases it's not till the second or third or fourth month that they have an improvement in the level of pathogenic microbes in their body, so that the symptoms from those microbes are diminished to the point where you can say, okay, now we've figured out that probably most of the rest of the symptoms that are left are coming from the silicone that's gotten out of the implant into the rest of the body and blocking up the lymphatic system. And then it's time to do the explant surgery to get the implant out, and then after that do the treatments to get the microscopic silicone out of the body. In 1991, I think it was, I had a woman call me. She was a Hollywood movie star, and she said, "Dr. Cowden, I need your help." I said, "Well, what can I do for you?" She said, "Well, I had silicone implants, and I got the silicone implants removed, but I'm still so sick I can't work. I can't remember. I've got brain fog. I can't remember my acting lines. I have excruciating pain in all of my muscles and all of my joints. I'm profoundly fatigued, and I can't go back to work." And I said, "Well, come to Dallas, and we'll see what we can figure out." So when she came to Dallas, I did some energetic testing on her and some standard testing on her, dark field microscopy and some other testing, and figured out what was going on with her. And so I created a protocol specifically for her to get the silicone out of her body, to get the microbes out of her body, to get the the other fungal infections and other stuff out of her body. And I didn't realize that she was so brain fogged she couldn't remember the instructions on how to do what she needed to do each day to get well. So we put her in a hotel, and I had my best nurse go to her hotel 2 hours twice a day to hold her hand and give her instruction and help her do her treatment. And so after about the 4th day, she had enough improvement in her brain fog where she could start remembering how to do the protocol. So she did that for the remainder of that week, and she we said, okay, well, now take all this equipment and supplements and stuff home and continue to do this, 1 week on and 2 weeks off until you get well. So after about 6 months, she called me and she said, I'm completely well. I went back to work. I can remember all my acting lines. I have no pain in my joints or my muscles. I have no fatigue. I feel like I'm completely well. And so thank you very much. And so she sent me one of her other Hollywood movie star friends, and we did the same thing for her. And then after that, dozens of other women.
So it's interesting. I don't think I had time to share it with you, but after I explained it 2 years ago, right? I mean, I sort of got much better, but then I had some persisting, symptoms that, because I moved also to Southampton, where there is a lot of tick-borne disease, Lyme disease, and I got bitten by tick a few times. I went to emergency care. They said, everything is okay with you. I had a blood test. It came negative. But then I was like, I started really feeling joint pain traveling all over my body. I experienced some swelling and severe fatigue, So I'm like 20 days into the protocol, and the first things that disappeared was my joint pain. I have nothing. It's all gone. And the second thing is, which is amazing, I have no more fatigue. I said, okay, we have to bring it, because I'm in touch with so many women in the Facebook groups, and they're all complaining of those that haven't healed after unblock, that they're still suffering from fatigue, brain fog, and some of them didn't actually improve. So, and I think that maybe it's time to ask you, Dr. Cowden, about what are the symptoms if you don't want to rely on a blood test.
Well, almost everything that Dr. Feingold said is the symptoms that you see with with the silicone implant disease, and so that makes it a challenge, because it could be mold or fungus in the air of the house that you're breathing in every day, and that can cause almost identical symptoms as well. So what we found is that in order to eliminate a microbe from the body, if you're using all natural antimicrobial herbals, you don't have to figure out the name of the bug to be successful. You don't have to necessarily do the test, keep doing the testing until you find a positive before you can start treatment. In allopathic medicine, oftentimes a patient comes into the doctor's office with yellow phlegm and cough, and the doctor says, well, you got a bronchitis or an early pneumonia. You need to take this empiric antibiotic and see if it works. And if it works, then the patient comes back and says, thank you, doctor, that empiric treatment protocol worked. Now, the herbals are safer than the antibiotics. They don't cause destruction of the friendly bacteria in the gut, because they're all in alcoholic tinctures. They're absorbed almost exclusively in the stomach and in the first part of the small intestine. Very little of it ever makes it into the jejunum or the ileum and the other parts of the intestine. And so it's absorbed into the bloodstream and goes throughout the body, seeking and searching and destroying the microbes that shouldn't be there.
So, I find this very interesting. And you had mentioned about starting people on this kind of protocol for several months, and then reassessing them with regards to operating on their implants. And that sounds great, but many of my patients have both symptoms, systemic symptoms, but they also have ruptured silicone implants or textured implants that have been recalled from the marketplace because of their own malignant potential, or pain or tightness from capsular contractures. And so I don't know that I would be able to apply this with a 4-month waiting period before initiating surgery to all of my patients, because sometimes they have multiple indications for having surgery.
No, I agree completely with you. Each patient has to be individualized. If a patient has saline implants and they have a lot of symptoms, then I think that might be an appropriate patient to try the herbal protocol for a bit and then see if they still have to have their saline implants removed. If they have a ruptured silicone implant, I think you need to go ahead and take that out, because I think it's just poisoning the lymphatic system more and more, and waiting is not prudent. So I think you have to individualize it for each patient, and then make the best decision that you can make. First trying to do no harm. We're admonished in the first day of medical school, first do no harm. And so we're doing the best that we can do, for the patient that's in front of us, not what's published in the peer-reviewed literature, but the patient that's in front of us. And that's what's really important. And that's what the patients expect, is to be treated as a patient, not as a number.
Well, you've definitely given me something to think about, because if I can test patients ahead of time for Borrelia with more sophisticated testing than an ELISA blot assay for, Lyme titer, if I can put them on an all natural herbal protocol and give it a waiting period because they don't have another pressing indication for going to the operating room. And many of my patients are smooth sailing with symptoms, and they're not ruptured and they're not textured. So there is a little breathing room. They're not all asking for surgery immediately anyway. It could change the trajectory about who gets surgery, because if their symptoms get better, they may want to reassess their decision to have surgery, and that's just fine with me.
I think that a lot of even saline implants can have mold or fungus in it, because I've examined some of those that were removed and found, fungus inside the saline implant. Now, the mycotoxins that are produced by the fungus inside the saline implants actually do come out through the capsule into the tissues, and we do know that the fungus is the mycotoxins that are produced by that fungus are immune suppressive and cancer causing. So, I agree that if a woman hasn't gotten the implants yet, maybe she needs to think twice about that, because there's some long-term risks possibly associated.
Yes, and there is another issue, because ultrasound and mammogram not always detect the ruptured implant.
Well, the mammogram is the least sensitive for evaluating implant integrity. It's really more about high resolution ultrasound or non-contrast MRI. But even those modalities are not 100% sensitive or specific. And so, yes, we have surprise findings where we're told implants are intact and we find degraded or ruptured implants, or we're told that an implant is ruptured and there's folding of the implant because of capsular contracture, but not actually a leakage or a degradation of the implant envelope. So imaging is important. It's just not 100% perfect.
I would like to add one additional evaluative tool that gets overlooked, unfortunately, which is thermography of the breast, or alpha thermodiagnostics, AlphaSite 9000 thermometry, which was developed in Germany. And those are pretty sensitive, actually, for breast cancer, at least. And so, those are non-invasive procedures that you can use in conjunction with ultrasound with Doppler. I believe that if you're going to do an ultrasound of the breast, it needs to be with Doppler, because the Doppler will show the abnormal blood vessels to a tumor. And if you have a lump in the breast that has no significant additional blood flow to it, probably it's benign. But if it has a lot of increased blood flow to it, it's probably malignant.
And I think maybe we can jump into your protocol, Dr. Cowden, and maybe just tell us, I think, your story. How did you come across that Cowden protocol, which are herbs that are from the Amazon rainforest, and then how is this applied, and so on?
Yeah, I was hosting a international integrative medicine cancer symposium in Fort Worth, Texas, and at that conference there was a naturopath who brought her grandson to the conference and said, "Can you please see if you can do anything for him, because before he became ill, he was an A student and an avid athlete, and now he can hardly get out of bed, and he's dropped his grades to D's and F's, and he can't think." And I said, "So what do you think's wrong with him?" She said, "Well, a Lyme literate physician said that he had Lyme disease, borreliosis, and he put him on a variety of antibiotics, and he got progressively worse. And so we know we can't keep doing that, but what else can we do?" So we happened to be standing in the exhibit hall next to the Nutrimedics booth, and so they had a product there on the shelf, on the table. It was called Cemento, I said, well, the people that make this product say that it's quite effective against a variety of infectious illnesses and has been used in the Peruvian rainforest for several hundred years for that purpose. So why don't we see, whether that has any effect? So she said, well, I think that sounds reasonable. So we gave her a couple of bottles of that to talk to the Lyme literate physician about. Well, she took her grandson to his house, and she went home to her house, but her grandson took the 2 bottles because he was standing there with me while I was talking about it. And his grandmother later learned that the grandson stopped all the antibiotics and started taking the 2 herbals because he was sick and tired of being sick and tired. And within a couple of weeks, he was markedly better. And within 2 months, he was completely well. And so he told his grandmother that what he had done. And she came to me and said, I told the Lyme literate physician that antibiotics had failed and this cemento stuff worked on him. And I wanted to find out whether it would work on anybody else that had Lyme disease. So the Lyme literate physician referred her 58 patients that had Lyme, confirmed Lyme disease by blood test. And so she put the patients on the cemento and a few other natural products, a few other herbal and vitamin and mineral products. And there, over 3 months' time, there was a 50% improvement in all those patients. And so she went to the doctor and said, if we do a controlled study, would you be willing to refer some more patients that have failed the antibiotic therapy? And so he said, yeah, I'd be glad to do that. So he referred 28 patients to her that were paired. They were paired by age, by degree of illness, by blood type, and by smoking history. And so he determined, the Lyme literate physician determined which one would go into his group and which one would come into the integrative group. Okay. So he continued to treat 14 of those patients to the best of his ability with the pharmaceutical medication that he had. He didn't know anything about integrative medicine or herbal therapies or anything. And the other 14 patients came over to our group. And on the initial evaluation, we found that one of those patients, a woman, had most likely had ovarian cancer that she didn't know she had. We did some electrodermal screening and some muscle testing to find that. And we sent her to get an ultrasound with Doppler and confirmed that it was probably cancer. So she was removed from our study and went on to have surgical removal of the ovarian cancer. And the other 13 remained in our study. And we did all natural therapies, took them off of all pharmaceutical drugs, and gave them only natural therapies, herbs and vitamins and minerals. And we did dark field microscopy on their blood every 2 weeks. And we did one dark field microscopy before they started. They just had swarms of microbes in their bloodstream. Okay, swarms, not just a few, but lots and lots. Some spiral-shaped bacteria that were probably Borrelia. They had Babesia, Bartonella, and a variety of other microbes in their bloodstream. And 2 weeks later, when we looked again, there was less. I said, well, I guess we're on the right path. Most of them had any symptom improvement by then. On the 4th week, there was a whole lot less. And by the 6th week, there was none in the bloodstream. We said, well, maybe they're hiding inside the red blood cells. So we used a paper clip to rub across the cover slip over the slide, and then looked again, and we saw quite a few bugs in quite a few bacteria in the bloodstream on the dark field microscopy. So we said, okay, well, we know we got to treat at least a couple more weeks, two more weeks that would crush the red blood cells again, and very, very few bugs at that point. And by the next week, I think it's that 8th week, we crushed the red blood cells and could not find any microbes inside their bloodstream. So between 8 and 10 weeks, they became free of microbes in their bloodstream. Now, we knew that probably there was still microbes in their liver, their brain, and other places because they still had symptoms to that effect. And so we continued treatment. And by the 18th week, we had an overall improvement in our treatment group of 90%. Okay, 90% of all the patients had improved, but the average improvement was 90%. And we had one fellow there that was 35 years old that had gone to 50 doctors before he came into our treatment study group. And he was told, he went 2 trips to Mayo Clinic and was told that there was nothing that could be done for him. Go home and get used to it. And by the 18th week, he was probably 70% improved. He continued this with me for another year, another few months after that. Study was formally finished at 18 weeks, and continued to follow my instruction. And he got completely well, even though he was told by all those other doctors he would never get well. He got completely well. He became so passionate about his recovery that he decided to become a naturopathic doctor. He moved to northwestern Arizona, bought a piece of property, built a house with his own hands, and studied to become a naturopath. And now he's helping other patients with Lyme disease in Las Vegas, Nevada. Another girl, 18 years old, was homebound, completely unable to go to school, doing all of her studies from home. And she was a beautiful girl, never had gone out on a date outside the house because she was having anaphylactic shock reactions to foods every day. And the parents were fearful that she would have an anaphylactic shock reaction and not make it. So she went on the protocol, and by the 18th week, she had improved about 70%. And the doctors said that she would never go to college, she would never graduate college, she would never, never get married, she'd never have a family. But I continued to follow her for another few months after that, after the study was finished in 18 weeks. And she was able to go to college, make A's, work her way through college, got her bachelor's degree, then got her master's degree, then got married, then continued to work on her PhD degree. Then she had a child, and then she finished her PhD degree, and now she's helping other people.
It's amazing.
So people don't have to take the prognosis of the allopathic doctors if they have Lyme disease. They need to search. Years ago there was a movie that was called Lorenzo's Oil, and for people that have not watched that movie, it's worthwhile because the parents were told that there's nothing that could be done for their son, but they didn't believe that, and they continued to search, and they finally found an oil that made him well. And so, oftentimes there's solutions out there, but a lot of the doctors are not taught those things in the allopathic training in the United States, and so patients unfortunately end up suffering because the doctors don't know what to do and don't know where to send them.
So I just want to mention that the Cowden protocol can be actually purchased online. You just have to Google it and you can purchase it. There are probably about 8 or 9 different bottles of herbs, including parsley, cilantro. Stevia is a major detox for the body for fungus. Is it? Tacuna.
Yeah. There's actually in the original protocol that's been going since 2007 or 8. There's actually 14 products that you eventually use over the following months, but the Nutrimatics company was getting negative feedback from patients because they said we can't do 14 different products and we can't do 4 dosings a day. So the new protocol, which is coming out next couple of months, is 10 products and down to 2 dosings per day. So I think more people will be able to do that.
Okay, so can you just talk about ozone IV treatment for detox of silicone? I think I heard you saying it in one of your podcasts, as well as the laser treatment, which is also successful in treating fungus, right? And other things?
The protocol that I developed had quite a degree of success. So it's only been modified minimally since 1991. And I've taught a few practitioners across the country, unfortunately not very many. There's one in the New York area, and let's see, she's in Carroll Gardens area of Brooklyn. Her name's Tracy Piper. But what that protocol involves is very intricate, and it's almost impossible to read about it and then do it and have success with it because it's so intricate. So usually the first time you do it, you need to do it with somebody that's done it before, holding your hand to try to get through the protocol and learn how to do everything. It involves a 7-day modified vegetable juice fast with ozonated Colema. A colema is a very large enema, 4 gallons of ozonated water rectally twice a day, every day. An ozonated bath once a day, a body soak bath once a day, lymphatic therapy 2 or 3 times a day, a laser detox procedure a couple of times during that week, and also some subconscious emotional conflict resolution, which causes the body to hold on to physical toxins more avidly. And usually the combination of those things will cause the patients to see white fluffy stuff coming out in the ozonated bath water about the 3rd or 4th day. They see white fluffy stuff coming out into the toilet the 3rd or 4th day. On the first couple of cleanses that we did, we scooped up some of that white fluffy stuff and sent it to a lab, and they said, this is silicone. And
all the practitioner actually that can help our listeners who are interested to go through that protocol. How can they reach them? How can they get in touch with them?
Yeah. So Tracy Piper is there in the New York area, and her cell phone number is 917-902-4594.
Okay.
And so she, is a colon hydrotherapist by training, but she's taken all kinds of trainings beyond that. So she knows a whole lot more than most colon hydrotherapists know.
Yeah.
And she probably, if 2 or 3 people go together, then they can get the economy of scale, we call it, so that they can have some reduction in the price. And then that results in being able to get through the week-long cleanse to learn how to do it. And then they'll have the instruction and the equipment and the supplements that they need to take after that to be able to get well.
Sounds good. Okay, so anything else you can mention about the laser that you talked earlier about?
Yeah, the laser interject detoxification I co-developed with 2 PhDs in 2001, and the principle is that homeopathy can help to remove from the body the things that shouldn't be there. Dr. Hahnemann, the founder of homeopathy in Germany in 1790, was actually able to successfully treat patients with severe cholera and other infectious illnesses using homeopathy. I have in my computer 5,000 references from the peer-reviewed literature showing the effectiveness and safety of homeopathy. So it's not just a little bit studied, it's a lot studied. And the principle of homeopathy is that you use drops of a homeopathic substance by mouth once or twice or sometimes 3 times a day for a period of time, and those toxins are mobilized out of the body as a result of taking that homeopathy. But it's a slow process, and what the 2 PhDs and I did in 2001 was to put the homeopathy in a clear glass vial like that one in front of a light, and shine the light through the vial onto the body, which then causes the toxins to come out of the body much faster, about 20 times faster than the next closest competitive technique.
Which practitioners are actually doing that?
Yeah, there's only a handful of practitioners in the country that do that as well. But Tracy has a little experience with that, and she's going to get a lot more experience with that on November 10th and 11th when she comes to our workshop in Dallas. Okay. Now, and hopefully you'll be able to come as well.
Yes.
And so then once you have some knowledge about how to do that properly, then it's a fairly safe technique and very effective technique. A few people get a Herxheimer type reaction when they do the laser detox, and so they need to know what to do about a Herxheimer reaction. They need to know what drainage remedies to use to prevent a Herxheimer reaction. Dr. Herxheimer
can you explain what is that reaction like?
So Dr. Herxheimer was a German physician who gave patients antimicrobial agents back about 100 years ago, and he saw that those patients developed nausea, vomiting, muscle aches, headaches, joint aches, fatigue, brain fog. And when he did drainage remedies, he was able to resolve the Herxheimer reaction fairly quickly. But if you don't know about how to use those drainage remedies, then the patient typically will stop the treatment that they were doing that caused the Herxheimer reaction, and about 2 or 3 days later, the symptoms all finally subside, and they can resume the treatment. And that's not a very efficient way to do things. So, yeah.
Is hydrocolonic also helpful when you're doing your protocol? In other words, to remove toxins?
Yep, it depends on what their bowel pattern is. Most people in the United States are constipated. I describe constipation as anything less than 3 bowel movements per day. Okay, therefore most Americans are constipated. But we should have a bowel movement when we wake up in the morning. If we wake up between 7 a.m. and 9 a.m., because that's when the colon detoxifies itself, and then they should have another bowel movement after each meal. And so if they're not having a bowel movement in the morning time when they wake up and also after each meal, then they're constipated. The toxins in the stool that don't come out into the toilet back up into the lymphatic system and clog up the lymphatic system, and then also back up into the liver and poison overload the liver. And so pretty soon you've lost 2 of your major detoxification pathways. So then toxins back up into the tissues.
Wow, I think we have covered quite a lot, and I could probably spend another hour just asking questions. Quite a lot of the complexity of diagnosis of these 2 conditions, Lyme disease and breast implant. I was hoping to talk a little bit about heavy metal toxicity and also 5G and EMF, which is electromagnetic fields, as big and great contributor to really making everything just worse. If you could say something about that from your experience.
Yeah, well, I think I'll say something about EMF first. The U.S. government says that if it doesn't cause thermal injury to the tissues, then the EMF is not harmful. And the reason that they say that is because most of the damage that occurs to the human body from EMF is not from thermal injury, it's from the other causes that EMF causes. And Dr. Martin Pall, P-A-L-L, PhD, in 2012, I think it was, wrote his first article about the harmful effects of EMF and how they work, how that effect is caused. But on almost every cell in the body, there is a receptor for EMF, and that receptor triggers a voltage-gated calcium channel that's on the cell membrane, which causes calcium to flood into the cell, which then causes free radical damage inside the cell, which then damages the interior wall of the cell membrane and all the organellar membranes, including the mitochondria, which is the energy packaging organelle for the cell. And so if you don't want to have that flooding process, then you need to reduce the EMF in your environment as much as you can. If you live in the city, that's harder and harder.
Yeah.
And also take large amounts of magnesium if you don't have kidney failure. If you have kidney failure, you have to be really cautious with magnesium because you can overdose the magnesium and develop cardiac arrhythmias and other life-threatening situations from the magnesium. But as long as your kidneys are working, you can take magnesium 4 times a day, after each meal and at bedtime, and keep increasing the dosage on the magnesium until you get loose bowels. That's called bowel tolerance. And if you maintain the magnesium, by the way, the United States government says that 57% of the American public are deficient in magnesium.
Mm-hmm.
And because the U.S. government always underestimates nutritional deficiencies significantly, my estimate is at least 87% of the American public are deficient in magnesium.
Yeah.
Magnesium is wasted through the kidneys into the toilet whenever a person's under stress. And I don't mean just emotional stress. I mean also electromagnetic stress, chemical stress, microbiological stress, structural stress, mental emotional stress, etc. So the magnesium is in short supply. And so if you take magnesium to bowel tolerance 4 times a day, it'll take you about 6 months to get caught up. But if you don't want it to take 6 months to get caught up because you're having atrial fibrillation or other cardiac arrhythmias and muscle cramps and fatigue and lots of other magnesium deficiency symptoms, then you need to be also doing Epsom salt foot soaks and Epsom salt thigh soaks. So I'm going to tell you how to do that. If you get a 5-gallon plastic bucket from the hardware store and fill it up with 3 gallons of very, very warm water, and preferably as clean a water as you can find, and put 1/4 cup of Epsom salt powder into that 3 gallons of water and dissolve it completely. And then once it's dissolved completely, put 2 small hand towels down in the water and saturate those hand towels with the Epsom salt soaked solution, and then wring them out, not completely dry, but not drippy, just a little bit wet still, and put those on your bare anterior thighs, the part of your thighs that are upward whenever you're sitting down, and then you also put your feet down in the bucket, and you sit there while you're watching TV, reading a book, working on the computer, folding laundry, or something else that you can do seated for 30 minutes. If you do that once a day, then it takes you, and you're also taking magnesium to bowel tolerance 4 times a day, it'll take you about 1 month to get caught up on your magnesium levels to where you will reduce the calcium flooding into the cells and causing the harm from the EMF exposure.
Oh, wow. That's amazing. Thank you so much. I want to thank both of you, Dr. Randall Feingold. You had a really long day at the surgery room, and you, Dr. Lee Cowden, for taking your time and sharing with us this incredible information. And I want to thank also our listener. And if you find this content interesting and helpful, please share it with your friends. Till next time, thank you.
Yeah,
Thank you
Dr.
both.
Feingold. Yeah, Dr. Feingold, I'm so glad to know that you're doing good work there in New York, because occasionally I get patients calling from that area saying, where can I go get my silicone implants out? So now I know. So thank you.
Well, it's very kind of you. Thank you. And I just want to thank you for the mountain of information you provided tonight, because I'll treat a couple of 100 patients a year with these types of complaints. But now I'm starting to think I need to broaden my approach, my listening, and maybe preparation of patients and holistic treatments and other therapies beyond the operating room. And I may not be able to deploy all of that myself. I may have to find a local practitioner to assist with that. But you've given me a lot of food for thought, so I thank you.
Yeah. Well, yeah, Leora is going to come to our workshop on November 10th and 11th.
Yes.
If you're available, come also with her. But if not, then she'll come back and probably be able to do quite a few of the things that we talked about tonight. All right. Thank you both.
Thank you, and good night for everybody.
Thank you. Good night.
Best of health. Thank you so much. I'll be in touch.